Good morning, ladies and gentlemen. My name is Councillor Gordon King, and I'm the Vice Chair of the Health Select Committee. And as the Chair is not available today, I am chairing this meeting. Can I say welcome to you? Welcome you to the. Welcome to this meeting this morning, and we have a full and varied agenda. And but as I know that a number of people need to leave by about 12:30, I hope we can rattle through it as quickly as we can. First of all, then, can we start off with apologies and substitutions?
Yes, Chairman. So I can confirm that apologies for absence have been received from Councillor Johnny Kidney, Councillor Dr. Monica Devendran, Kate Blackburn, Alison Smith, Councillor Ashley O'Neill, Councillor Nick Holder, Emma Legg, Councillor Graham Wright, Councillor Laura Mays, Lucy Baker, Paula Weston-Burt, Terence Herbert, Caroline Finch and Fiona Slevin-Brown. Thank you, Chair.
Thank you very much. I would also like to extend a welcome to Carol Shirley, who is substituted for Caroline Finch as the Wiltshire SIL representative. So, welcome. The minutes of the previous meeting, to approve and sign the minutes of the meeting held on the 12th of June 2024. First of all, can I ask if there's any comments or corrections to the minutes that we should make? No? So can I take them as a true record? Yeah. Yeah, I don't see any dissensions. Thank you very much. Declarations of interest. To receive the declarations, disclosable interests or dispensations granted by the Standards Committee. Are there any? Thank you very much. Item 4 is Chairman's announcements. We have an opportunity to clarify the appointment process for stakeholder and non-voting members of the committee. A report presenting options will come to the committee in September. In the meantime, if members have any questions or suggestions, please contact our Senior Scrutiny Officer, who is Marie to my right. Okay. Cabinet reports. 2 reports were considered by Cabinet earlier this week that were of interest to the committee. Wiltshire Community Advice and Support Services, a briefing for Chair and Vice Chair took place before Cabinet. Option 2 was approved. The recommissioning, procurement and implementation of the core and carers elements of the Wiltshire Community Advice and Support Services for a minimum of 5 years, with an option to extend for an additional 2 years with an uplift mechanism. And then ICB, Community Health Services Procurement, it was approved to deliver the Home First service under a single provider, Reablement Wiltshire, and to give in principle agreement to commit better care funding of £9.235123 million to the ICB Community Health contract from 2025 to 32. With the potential for a further 2 years to 2034. You may recall that committee had briefings on the ICB procurement and emergency care contract in October 2023 and June 2024. Item 5 is public participation. There is none. Can I just say, to go back to my introductions and welcomes, I'd like to welcome Eloise, who sat at the back there. Eloise is a work experience student who's come today to observe the workings of the committee. We'd like to say welcome to her and hope that she enjoys her time with us. So item 6 is the unpaid carers strategy and contract update. We have with us Councillor Jane Davis, who's the Cabinet Member for Adult Social Care, Alison Elliott and Carl Muxlow to introduce the report.
Hello, good morning. I think officers have prepared to introduce this. I think Alison's going to introduce it, and it's Kai, not Carl. I heard Carl, so maybe my hearing, but just for clarity.
You're
Kai
right, it
Muxlow.
is Kai. Thank you very much. You are. Yes.
Thank you, Chair. This paper is an update for members of Health Select in terms of the work that has been ongoing around the development of the carers strategy. So the carers strategy is an all-age strategy. We view children as carers from 5 years of age, so it's from 5 years of age right up. In terms of the development of that strategy, we heavily engaged with unpaid carers and with young carers to develop that strategy. And we focused on the word of carers and how they wanted carers services to be provided in the future. And on that basis, we went out to tender for a new contract. And that contract was awarded to a consortium of providers for adult services for adults over the age of 18, because carers had told us that actually it was very important to have support from an organisation that understood the issues that they were facing. So if they had somebody with dementia, it was really helpful to have Alzheimer's Society involved in supporting them. So it's a consortium of organisations who provide support across the age range. So in terms of the new contract then, the new contract went live on the 1st of April 2024. And we have 3 elements to that contract. So we have the support provided, and from an adult's perspective, the organisation, the consortium is called Carers Together, and they support carers, and they also undertake statutory carers assessments for adults over the age of 18. We also have a digital solution, so we have a digital organisation who support carers with their carers card, emergency card, but also provide information via apps for because that's how people access information now in the main. So enables people to access information around carers and support quickly through that methodology. And we also have carers support for children from the age of 5 to 18. The carers assessments for children are undertaken by Children and Family Services internally within the council. So that's been operational since April the 1st. We've had some good progress. We're working very hard with our carers organisations to ensure that they are fulfilling the needs of their contract. We have established what we call a performance outcomes group for carers so that we can monitor the progress of their performance on a monthly basis, so we can ensure that carers assessments are being undertaken in a timely way, that support is being delivered to children and young people. So that is ongoing, and our relationship with the organisations that are involved in that consortium has been positive to date. Although I have to say we have been challenging in ensuring they meet their requirements, because members may be aware that previously we had some problems in terms of undertaking those statutory assessments. So that's where we are to date, and I'm happy to take any questions. Members will also, just to remind myself really, that we have also been able to successfully complete the memorandum of understanding and the unpaid carers charter as a council, which is, I think it's an important statement about how we as a council view unpaid carers. And certainly our feedback is that carers feel valued by that. Happy to take any questions.
Are there any questions? Richie? David?
Thank you, Chair. When we say, is it a monthly review you do? I'm trying to understand, is that of all carers? Do you go through the entire list of carers, checking that you're up to date in terms of supporting them? How many carers are there, and how does it work to have a monthly review?
So on that monthly review, we will review the key performance indicators that are set within the contract. So we will review the timeliness of assessments. So from the point at which they receive an assessment, how quickly are they undertaking that assessment? We will review how many people are waiting for an assessment, what is the length of time that people are waiting, are people getting their reviews on time, what's the outcome of their support plans. So we'll be reviewing all those KPIs, and for children, young people as carers, we'll be ensuring that within the contract, those KPIs, because they don't relate to assessments for children and young people, will also be met. So yeah. Is that okay?
Thank you. I have got a few questions, if that's okay. Thank you. First of all, I have to say that, let you know that I am a carers champion. Okay. One of the only three, I think, that there are at the moment. I've read the report, and obviously I've been quite involved in it. And I have got a few questions, if that's okay. In no particular order. The face-to-face training, for instance, for Wiltshire unpaid carers, I'm just wondering, because they are not all understandably based exactly in every town. So what's the situation for carers being able to have transport to get to these training sessions?
I'm really sorry, but I don't know, but I will find out for you.
Thank you, because that is so important. So many carers, you know, and alongside that really is, even if they have transport, if they're caring for somebody, is somebody going to go in and look after the person that they're caring for?
So I do know that, and we will support the a carer to enable them to attend the training by supporting the cared for person. So we will put in that support.
Can I carry on, Gordon? Is that okay? So the same would apply.
Not too many, though.
No, okay. I will hold some back. I also wondered, will that also apply if people are going not just to training, but let's say to a carers cafe?
So as part of the assessment, when we undertake a statutory carers assessment, we will look at what an individual's needs are, and if going to a carers cafe or whatever it is. So I was looking at one the other day actually, and what we've done is we've paid for somebody to have a flight to Spain. So we will support that individual to enable them to fulfill their needs and wishes as part of their role as a carer, so that they can continue to care. So if going to a cafe was important, then we would put in support to enable them to do that.
Could I have one last question? Okay. I don't know that you'll be able to answer this, but as carers champion, I was approached only yesterday by people that are carers that have been had letters, I understand they were letters, the new emergency cards, and in actual fact they cannot contact or get hold of anybody in response to this letter.
So you're absolutely right. We have had problems, significant problems with that. I have to apologise because that's our fault. So unfortunately, when we sent out the letter to carers around the new emergency card, because it's a new provider, it can be a card on somebody's phone, an app, but it can also be a physical card because people were anxious, they wanted a physical card. But unfortunately, when we sent out the letter, we sent out the wrong telephone number. So that is entirely our fault. So we are hugely apologetic. We are working with carers together. We are putting in additional resource so that they can respond to people's concerns. Because my anxiety was that this was a change for people and they've got enough on, really. So to make it as easy as possible for them to make this change, but unfortunately we've made it more complicated. So, but we have put in additional resource. I've agreed the funding this morning. That resource will go into Carers Together. They will be able to respond to people's queries. So I am sorry about that.
Thank you. This is to follow on from David's question. You said that the new consortium will be monitored on their delivering of KPIs. Now, this is an unofficial personal observation that the previous providers, nothing seemed to happen with poor delivery. And what are the penalties going to be on the new providers to deliver up to the standard? And I've got another question as well afterwards, but that one first.
So I think it's fair to say that our contract monitoring of the previous provider was not adequate, and that you're absolutely right. They went for quite a long time without us monitoring that contract effectively. We have learnt from that position. So we have a dedicated resource, a dedicated member of staff who is monitoring that contract. We've actually put in a more senior member of staff as well to support them, because this is a very important contract for us. You know, it's £1.3 million. It's the ICB and ourselves. Unpaired carers are extremely valuable and important to the council. So we have a more senior member of staff who is supporting that colleague to make sure that those contract monitoring meetings are effective and the organisation is appropriately challenged if they're not meeting their KPIs, and they put in place remedial actions so that they can meet that. And the introduction of the performance oversight group means that we are monitoring their performance. A range of colleagues within commissioning and operational staff are monitoring their performance on a monthly basis. And that feeds into a more senior organisational performance board. So there is oversight within the council, very good oversight within the council of their performance.
No, I want to make a point, but can everybody who's speaking speak into the mic
Sorry.
and not turn their heads like that, because
Sorry.
it loses the sound. Thank you.
So in terms of your point, what will happen? So there are contractual penalties if they do not meet their KPIs, and we will implement those.
Okay, thank you. My second question is that Diane raised that there are only 3 carers champions across the county, and it's 17 or 18 area boards. 18, thank you. And the report talked about additional carers champions, but I think first of all it's necessary to look at why haven't the other 15 area boards got carers champions, and what's going to be done about that?
So we are working with the area boards in terms of increasing the number of carers champions and ensuring that each area board has a carers champion. So that's our priority for this year, working with them to increase the number of carers champions, so we can report back on our success on that. Okay.
Anybody else with a question? David Bowler.
Thank you very much for the report. When I was reading the report through, being as my background has been in social care, I was concerned at the number of children under the age of 18 that were providing care for people that needed care. I did know that from the report that I believe there's been a new post to support young people in secondary education. But both nationally and locally, we have carers that are in primary education. And in the report, it didn't give me any indication of how these young people between the ages of probably 5 and 11 are receiving their support as carers. And I wondered if we knew how many fell into that category in Wiltshire.
So we do know that, and we do know that figure. I haven't got it on the top of my head, but we also know we are also working very closely with our education colleagues because we also monitor attainment, both at primary and secondary level, and the impact of caring on children and young people's attainment. So, so we are looking at that as an issue that we need to address across the council. In terms of the support that we have put in, you're absolutely right, we have put in a post in terms of secondary education. There isn't a post in terms of primary education, but we have put additional posts into children's services to support carers from the age of 5. So whilst they're not in the primary education, they have those posts have a responsibility to support those children as well. We will monitor that, and if we are not delivering against that, then we will need to review that. And Kai's going to come in if
And
that's
I would
okay.
just like to add to that, obviously part of the process is how we work. There are education providers, so it is about going into schools, it's talking to schools. So we're doing an education piece with schools about young carers to support them, because obviously sometimes the young carers themselves don't actually self-identify, particularly at younger ages. So it's about supporting teachers to be able to support those young people to have those conversations in a really supportive and nurturing way, so that we're aware of them and that we can support them further. So it is, while we are primarily focused on the secondary education with that role, we are going into primary schools and working with those settings to make sure that they can support those young people at the earliest stage possible.
Is there any other question? Well, I just have one question. At the very top in your table at the top, you nicely show us that there's a difference between support and well-being, in as much as how carers feel a good quality of life and social contact. And I just wonder how will these two contracts and the detail therein lead to, improvements in those two categories?
So within the contract, there is a requirement to ensure access, the establishment and access to existing support groups and clubs. There is a requirement to publicise and support the identification, for people to identify as carers. And once they have identified as carers, to look at points at which they can access support services within the community. So that's part of the contract, both across the age range, really. So how do we support children accessing community facilities? How do we ensure that adult carers have access to those support mechanisms that they require? So that's within the contract. So we will monitor that against that. We will also monitor, so one of the things we've asked the consortium to do is we do it. Adult social care have to do a 2-year survey of unpaid carers, and that asks questions like isolation, access to employment, those kind of things. We've also asked the consortium to do that more regularly for us, so because 2 years is a long time to wait to get that kind of information, so to have that information more regularly so we can act more speedily in terms of ensuring that there is that support and access.
Engendered another question from Diane.
I'm not sure that you can answer this, but I am very, very aware, certainly in my area, that all those people on the health side, i.e. surgeries, etc., have not been made aware of this new contract and how to contact people. I mean, for instance, I do know that when they're doing carers' health checks, which are brilliant, that in the past they have contacted the previous provider to actually come along, signpost and, you know, do all those things that are important for carers. But they were not aware until I told them that there was a new contractor and how to contact them. So I'm just saying it's a bit of a worry, really.
So thank you for telling them, first of all. So we have worked with our colleagues in the ICB to ensure a communication plan to everyone. I think the reality is, as you have very well described, you can't communicate enough, can you? So on the back of that, I will go back and make sure that those communications have gone out. Okay, thank you.
Last check then. Any other question? No. Then I've got a couple of draft thoughts for recommendations. First of all, I wondered if you, Alison, you wouldn't mind providing a future date, a briefing to the committee on the roles of the different providers and their role in delivering to unpaid carers via the contract to support an agenda item coming to the committee on the 12th of March. Okay. I think it'd also be, be quite good if you could give some idea of the detailed implementation of that new contract, and indeed the details of the KPIs of which you've mentioned today. So that would be fine. Everybody in agreement with those? I take it so. Thank you very much. Item 7 is the Wiltshire Joint Health and Wellbeing Strategy and Integrated Care System Strategy. That's a mouthful. Progress Performance Reporting Update, which are on pages 41 to 54 of the agenda pack. This, I hope, will provide an overview of progress towards the objectives set in the local joint health and wellbeing strategy and the integrated care system strategy implementation plan. With us today, we have Jane, Emma Higgins, who's the Associate Director of the ICB, and colleague. Emma, would you like to kick off?
Thank you. So firstly, I just want to let you know that this paper has been to the Health and Wellbeing Board. So it is sort of 6 weeks further on from that point. The paper hopefully sets out for you how we've been working together across the system in the local authority and in the NHS, and including other partners, to jointly develop the Joint Local Health and Wellbeing Strategy and the NHS Integrated Care System Implementation Plan. Apologies for such lengthy, wordy strategy terminology. But essentially, those two documents align with each other. They are identical in terms of the Wiltshire components of those things. And so for the first time, we are agreed and coalesced around a shared set of priorities that we're working to take forward across all of our delivery work in the system. This is also the first time that we're trying to jointly monitor our progress across all of that. And so what I would say is that I know that the Excel spreadsheet that's attached to the bottom of this report is probably impenetrable for you to read and understand. It's not meant for you to get into the detail of it. It's meant to show you the level and extent of detail of which we are trying to pull all of this together. That will be improved over time, but if you do have any queries on it, I'm very happy to take any of those away or answer what I can today. As you will appreciate, this is a whole system piece of work that we're working to improve. The other thing about that document is it sets out a schedule. Because of the complexity of the work that we're trying to provide assurance and progress monitoring around, we can't do that for every single element of that every month or every quarter. So we are setting out a schedule through which everyone in this room and in other committees can expect to see assurance and information come through. So for example, in September, it will be the turn of our urgent care and flow system, timed right before the winter phase of our work. So hopefully you'll be able to see that coming through. There are elements of our assurance process that have already changed, for example. So things are evolving all of the time. So that are things that we identify as key performance indicators and data sets that we're pulling together across the system have already evolved and improved and moved forward. So you will see that this improves and changes in line with the work that we do over time. Each year there is a refresh. So the refresh for the implementation plan will happen at the end of this month. So in a couple of weeks, there'll be a refreshed implementation plan that will be published on the Integrated Care Board and the Integrated Care System website, the Integrated Care Partnership websites, and that will be brought through and updated as well. You'll see the paper splits between progress and key highlights against some of the key things that we've identified and things we said we'd do together, and then articulate some of the key things that we're going to do over the coming year, and you'll see those reported as well. So essentially, I'm really happy to take any questions. There's quite a lot to take in this paper. It's the first time I think you will have seen it. Really happy to take feedback on how we can improve this going forward as well. Thank you.
And thank you, Emma. That was a very comprehensive run through of the paper. Is there any questions for Emma? I guess my principal question is, I really get the complexity of it. I think that really does shine through the paper, particularly in the charts at the bottom, which are barely readable, I'm afraid. I'm sure we asked you this, the Health and Wellbeing Board, actually, you know, is there a better way of, or can you find a better way of presenting that information which can be a greater aid to people when they're reading it?
Yes, and it was a good challenge at the Health and Wellbeing Board. I think the Health and Wellbeing Board wanted to see it all brought together in one place, which we've now done. But our intention going forward is to bring narrative reports that include the assessment against our performance standards that the spreadsheet articulates. So you won't see it in this format again. You will see a narrative report and assurance in the style that I hope you're familiar with, but it will include assessments against where we said we would be, where we need to go next, what we need to do to resolve any issues, that kind of thing. So, but it is all here so that people have we can provide you with an electronic version if it's easier, but everyone should then be able to understand the schedule at which we're bringing things through. My new job title is Head of Combined Place, and I'll be working across Wiltshire, Swindon and Baines to make sure that we take a shared approach to all of this as well. And the things that we bring through here, we will also share with our 2 other local authority areas, which also enables us to understand how we are comparing. But the things that are in this report are very particular to Wiltshire. We don't have the same shared priorities across the whole system. So this is about what's important from a Wiltshire population perspective, and that's what's reflected in this report.
Diane and then David Vigar.
Thank you. I've got 2 questions, if that's okay. The first one is about the improvement group that has been established, working in partnership, obviously, with voluntary sector colleagues. I'd be quite interested to know a little bit more about that if there's time, because I am very aware that, particularly for people with autism, and I'm presuming that this covers people with autism as well as learning disabilities, that they do not take up their health checks. So I'd be quite keen on that one. And my second question was really about how is the Caring Steps Together developing? I actually have to say that this week I have got Luke come in to talk to Calne Health and Social Care Forum because of issues that have been raised, but I'd be interested to hear from you about that. Thank you.
Thank you. So your first query, the improvement group. So I can get more information for you on the detail. If you had been able to read the spreadsheet, you would see, and I know you can't, but there are clear indicators in there around the uptake of health checks for our population that you describe. What I do know is that that has significantly improved, but there's absolutely still more to do, and it does remain a high priority, which is why it's one of those things. You will see, I don't have the zoomed in version to see, but there will be a report that will come through to provide you with more detail and assurance from that, but I will take that back and get the answer to your query in terms of the detail on the improvement group. The second query, caring steps together. So that piece of work was led by Wiltshire and was developed across the whole of BSW and has been implemented across the whole of BSW. We are going through an evaluation process at the moment to understand how it's being used, where it's being used. And for those of you that aren't familiar with Caring Steps Together, it has fundamentally rewritten and changed the information we provide for our population across Bain, Swindon and Wiltshire when they are being discharged from hospital. And that's actually quite a complex process, and it can be really difficult for people to navigate at a really difficult time for them. So we worked with our communities to totally redesign the resources that are available, and we can make that link available if anyone wants to see more about it. We have had approaches around other populations, maternity, people with dementia, other languages, easy read versions, etc. So we're at that point of understanding what our communities want and whether there is scope to implement other versions of that. Because we took the time to co-design it through going through co-production exercises, we own the rights to all of the imagery that has been used in that. And those people were recruited specifically to represent our population. And they told us how they wanted to see themselves. So we are able to put new resources together under that branding, if you like, or that approach, that umbrella. So it's about understanding what our communities want. So I'm really grateful that Luke's coming to see you next week. He's absolutely passionate about that and was really involved in the development and the rollout of it. So he will be the perfect person to gather more information from you and think about the evaluation. Thank you.
Yeah, thank you very much for the report. I'm just looking at the highlights of the strategy themes here, and what I'm just thinking to myself is this is a complex system, NHS and care, with many different facets, many different operating parts. And when you're operating with complex, and we're looking at it through a certain lens here, when you're operating with complicated systems, it's very important to understand what is it it's intended to drive a certain outcome and what is auditing the outcome. So what's the driver and what's the auditor? When I look at something, for example, just to take an example, like screening and vaccination, flu vaccination, good, 85% for people 85 years. But is it the intention that this strategy drives flu vaccination rates, or is it the work with the primary care system and GPs, surgeries to drive it? Is it clear who is responsible for driving something like that and who is responsible for monitoring and auditing it? And where does this strategy fit in to that continuum between being a driver and being a monitor?
Thank you. That's a really good point. And I think we do have a temptation to oversimplify really complex things. I think some of this is still to be worked through. There's the primary community and delivery group strategy. We have obviously, every year we have new targets and mandates that we have to hit. I think the answer is both and. So I think it's really clear who has the commissioned responsibility for delivering those vaccines, for example, but it's incumbent on all of us as partners to try and really increase the uptake of those vaccines. So we're doing things, for example, we've got the Accelerator Vaccine Fund that we've come together to use in the Neighbour Collaborative Programme. We're currently working in the livestock market in Salisbury to increase the uptake of vaccines in that space because they are notoriously low in uptake, but they are telling us things like flu, shingles, and other vaccines are really important to them as that particular community. But we're working as a whole system. So I think you're absolutely right. The audited outcome, the KPI is one thing. You're right to make the link to the intention, and that's one of the things that we hope that the this way of monitoring things will go in the future in terms of that's part of our next step. So what we don't want to do is hit the KPI but miss the point. Absolutely. So we do need to make sure, and that's why our reporting in future will hopefully be more sensitive and live to that. But I think it's both and, it's push and pull. We all have accountability and responsibility, but the delivery is really clear in terms of where that sits.
Yeah, thank you very much. That's very, very helpful. I mean, if you were to be operating a physical system, like a manufacturing plant, you know, there you've got an assembly line. It's very clear that somebody is responsible for pressing the button that makes the assembly line work. Someone else is responsible for checking that all the products are coming out correctly. So I think in all these sorts of things, it's useful for us to know, for it to be kind of quite clearly signposted as to who is accountable for driving a certain outcome and who's accountable for monitoring it. And if there's an element of sharing, then obviously that is where problems can occur, because things can fall between those different parties. So I think getting that as clear as possible is good. But thank you for the answer. That does help to clarify. Thank you.
Are there any other questions? Emma, throughout the document, and you just made reference to it as the Neighbourhood Collaborative, could you just give the committee a little refresh about Neighbourhood Collaboratives and where we are with them now?
Yes, I can, there's a handy set of slides actually that I've recently put together that I can share that might be helpful, but certainly give a brief overview. So from a Neighbourhood Collaboratives perspective, hopefully you're familiar with what we're trying to do, but it's about building a collaborative group in each population area. So that's roughly aligned to our PCN network, our primary care network footprints, populations of about 30 to 50,000, but recognising that neighbourhoods can be much smaller parts of that footprint. We are working to build networks of partners. So that's the NHS, that's local authority in many different forms, that's our VCSA sector colleagues, that's many other organisations. For example, the livestock market I referenced just now, we're working with Salisbury Livestock Market Auction House as a key partner. So we are working in each area to bring together partners to understand the community's views on their health and well-being and their challenges in that space, to understand our data together in ways that we haven't been able to do before, and to put together groups of people to address some of the inequalities that we're seeing from a prevention perspective. So Chippenham, Corsham and Box, we're starting to work on a high blood pressure prevention piece of work. So we've identified people who are at risk of developing blood pressure. So the idea is that we work with them collectively so that they don't go on to develop high blood pressure. Melksham, we're working to prevent significant falls, and we're starting to consider another cohort of people to work with. Salisbury, we've started to work around the farming and rural community and the inequalities that they experience. I was there yesterday. We had all sorts of unmet need that we're now starting to be able to identify and meet in that space. We are working with North Wiltshire Borders in the Malmesbury and surrounding area. We're starting to work with Devises on bringing partners together, and they want to look at prevention of self-harm and suicide amongst young people. We've had conversations in Westbury and Warminster. The only two areas as yet where we're not starting on this journey at the moment is Kennet and Calm at the moment, but there is scope and capacity. We're working with each individual area when they are ready, in the way that they are ready to work. So that's where we are at the moment. But I have a few short slides that hopefully I can share with you, and that will give you a more helpful overview of where we're at.
Thank you, Emma. Diane. That's all right.
It was just a quick one, really, because now we've talked about neighbourhood collaboratives. I was wondering if you've got a very brief oversight on community conversations.
Yes. Absolutely. The part of the Neighbourhood Collaboratives approach is that we don't duplicate or replace anything, and we build a strong network of partners. So we've got a network of individual collaboratives in various different stages developed, but we also have a Wiltshire-wide group who meet to really think through how we work together. Community Conversations is an essential partner in that space. So we're learning from them and their approach, and they're feeding into us. We're feeding into them as well. So in Chippenham, Corsham and Box, for example, The work I referenced around the prevention of hypertension, we're working with Louise, who's the key lead in that area, to identify people who fit into our cohort, that we've about 150 people, about 150 people at the moment. How many of those and who are the ones that live in that area, and how do we work with them specifically? What are their needs and challenges? So community conversations, the Families and Children's Transformation Programme, many others we are working with and connecting with. This isn't about doing something that's different or on top of or duplicating or changing anything. It's very much taking that strengths-based, community-led approach. So yeah, absolutely. Thank you.
Is there any other question? Could I also ask you that in terms of systems flow priorities, including carer breakdown, what do you mean by that?
Could you point to Alison's looking at me. Did you want to take this one? No? So inevitably, we see people coming through our system who require support because their arrangements at home have broken down in some way, shape or form. And so that has been reflected in the work that we're doing. It's a key area for us. We know there are people admitted to hospital who shouldn't be, but because that is a place of safety for them, because the arrangements at home have broken down. So clearly we're working across the system to try and prevent that in many different ways, including through the new carer strategy, in our work in Home First, in our work in urgent care and response, in our work in virtual wards, to really think through what's the best outcome and the best support that we can give to people in that situation. We don't get it right every time. Well, we don't get it right very often at the minute. There are really good examples of where that does go very well and the right thing happens for the right person at the right time. We want to do more of that and learn from that. So for us, it's just about acknowledging that as a really key priority for us and working through it.
Then I think the two possible recommendations here. For the committee to receive updates through the year on the Chippenham Caution Box launch programme and rollout with measures of success. To receive an updates on the Salisbury Collaborative, including rollout with the farmers and initial focus and measuring again with impacts and successes. And progress on targets on every area 13 to establish collaboratives but in 2025. I would also like to include in that that the committee would like to receive a simpler reporting mechanism in the future, and we look forward to seeing that. All those in favour?
Did you want anything about the carers support, which links in with the item before?
Just would like to add to receive updates on additional capacity for domiciliary care to support carer breakdown, preventing avoidable admissions to hospital.
I think just also above all that, we have to just note the update, don't we? That's the proposal at the top.
Item 8 is the Better Care Fund. The committee will receive an update on the progress being made in delivering the Better Care Fund, and I welcome Helen Mullinger and Carl Deeprose to produce the report.
Hi there. I did have some slides, which is it possible to share them on the? That might be better. If you invite me, then I can control it. If I'm no good at tech, you'll have to. Apologies. Oh, hang on. One second. Where does that invite come up here? Okay, yep. Thank you. I have one here. Lovely, thank you. Thank you, Carl.
Can I just say before we start that you find the slides in the agenda supplement?
Oh, okay, sorry, I didn't know whether I could share my screen. Is that? Marvellous, well done. Okay, my name is Helen Mullinger. I am the Better Care Fund Commissioning Manager here at Wiltshire Council. Can everyone hear me okay? Yeah, sorry. Just about. Okay, sorry. So these chairs are so big, I kind of have to perch on the end, otherwise, and it's really uncomfortable. So as I say, Better Care Fund Commissioning Manager. The Better Care Fund is we've got a total in 24-25 of £68 million. That is a pooled budget which we manage in partnership with our ICB colleagues, and the spend of this money is governed by a Section 75 agreement which sets out how we will work together and how we will decide on what we are going to spend that money on. We are guided very much as well on what that spend should be attributed to by the national team. There's a lot of focus around hospital discharge schemes, which you'll appreciate in a while. As I go through these slides, I'm just going to put my glass off actually. Okay, so in terms of the national context, this was just to give you a little bit of an idea of where the money is spent. There's a lot of it goes on contracts and things such as our community equipment contract. There's a range of in-house services that we run, such as reablement, some of our mental health support services, and there's wider system-wide support. We do support the adult social care capacity within our teams as well through the Better Care Fund money. And we also govern some of the DFG money, which is around housing adaptations for people. So I just wanted to go through some of our key contracts, and this is where sort of the money goes and where we see real impact for this money. So our biggest contract by far is the community equipment one. We spend nearly £8 million a year, and we have 1,800 service users a month and up to 2,000 deliveries of equipment across Wiltshire. That supports people to stay at home, it supports hospital discharges, and it also includes things like minor adaptations, grab rails, key locks. So that also supports our OTs in Home First and reablement to support people at home. We have a service that supports people going home on Pathway Zero. Those are those people that are sort of able enough to go home. That's called Home from Hospital, run by Age UK Baines, and that provides a range of assistance around shopping, meal prep. And again, it's about making people comfortable at home, helping them with referrals to Onward PAPS voluntary groups and to keep them at home. We have the Pathway 1 services across reablement and Home First, which is, again, it's about those people that need a little bit more help with some rehabilitation, and those services will support those people at home. We also pay for bedded care around those people that are slightly more complex, that need a bedded setting for their rehabilitation. Excuse me. We do also support a range of crisis response services, urgent care at home, rapid response, and our telecare lifeline and support service. And again, it's about keeping people at home and supporting them to be as independent as possible. The Better Care Fund does also fund those 3 carers contracts, which you've just had a presentation about this morning. We also commit money to the Community Health Services contract run by Wiltshire Health and Care, and they do a range of schemes, just some of them listed there. Again, focuses around discharge and other community health services. We also fund the prevention and wellbeing team roles, not all the whole team, but we do work with them. And we would like to use some of the Better Care Fund money to think about more preventative schemes. Our hands are a little tied by the national kind of edit as to what we do with the money. But certainly I think nationally as well, they're coming around to a way of thinking that we might have a bit more preventative type approach to some of our schemes. So that'll be quite exciting to see how we can think about prevention in the wider context. Again, we do fund additional capacity in adult social care services and also support for capacity around home care for those complex cases as well. Again, that's around some hospital discharge support, making sure people are in the best place possible. And all of our care around hospital discharge is focused on rehabilitation and getting people home and independent wherever possible. And so a lot of these services are very, very closely linked. And as you can imagine, the community equipment one, the swift delivery of community equipment will support a whole range of these services. Just moving on, we are held to account with our spend by the national team with a set of performance metrics set by the national team. And these are sort of planned targets for this year. There's a slight nuance around the admissions to residential and care homes. We are very keen to reduce new admissions to residential and care homes, just to reflect that we know people would rather be in their own homes. And so we're keeping a very close eye on that. And in Q1, actually this year, we haven't seen the figures yet, but in Q1, that figure is actually looking quite healthy. So we are focusing on that this year. We will also be looking at falls this year as a priority because, as Emma mentioned already, around the neighbourhood collaboratives, there are pockets of some very good work around falls. It's just how we collect that together as a council across the county to think about what collective impact that's having on admissions to hospitals due to falls. And we've got information and data from that from our telecare and our telecare response contracts that we manage, because we can see the data around the number of people that do have falls, non-injurious falls, and those that are conveyed to hospital. So there's a close link between that contract management and the data that we see from that feeds into these metrics and feeds into our planning. So very quickly, we have a lot of oversight as to what we spend it on, and these are just some of the groups. The locality commissioning group is the main one that has delegated financial decision making for funds. And as you say, the Health and Wellbeing Board has overall accountability to sign off on these plans. And as I say, I did make this presentation to the Health and Wellbeing Board just last week. So I'm just going to show you this slide first because I love it and I can take no credit for this at all, but the lady behind me, she's still here, Emma Higgins. Yes, Emma Higgins does these slides. So there is an awful lot of focus at the moment in our system around understanding our demand and capacity. And there is a significant piece of ongoing work around identifying all of our discharge schemes, all of our support schemes, and what that looks like in terms of the demand and capacity across Wiltshire. And what that focuses our minds on, because we are made to report this in our planning to the national team, is that what we've got to the state now with the work that Emma's done is that we can actually inform our operational planning, and we can evidence that we've made some operational planning decisions around this demand and capacity. So, for instance, the modelling tool that Emma uses, it demonstrated to us that we wouldn't have enough capacity in Pathway 1 in the Home First services going forward. So we have secured some additional funding from UEC around that. And again, that piece of work will develop next year, looking at Pathway 2, how we need to influence perhaps length of stay and capacity and all those sort of action plans around those services. So this is all very, very closely linked with those services that BCF funds. And going forward, we will have a BSW-wide demand and capacity group. So while I've made connections with the with the Baines and the Swindon BCF leads, that is going to become a bit wider now. Now that with the changes at the ICB, we will have a much we'll have a BSW approach to our quarterly returns and our planning for the next planning round, which will be from 25 to 27. And it's just really not necessarily all being the same, but actually understanding the differences between Baines, Swindon and Wiltshire, and providing the narrative to the national team as to why we've done things differently in localities. I mean, almost certainly there may be lots of things we can learn from one another as well. So I'll go through to this one. Again, so this just to reiterate what I've already said, really, is about the department capacity work that underpins all this is around making those operational decisions. And the Pathway 2 will again be reviewed this year. And we are also looking as well at our community equipment as we come up for a retender for that in 18 months' time. There's always note made of additional discharge funding, which we are given each year now. It used to be called the winter pressures money. And we use that to support additional discharges from hospital as we are directed to do so by the national team. And we've used that recently to bolster community equipment supply, to provide extra capacity embedded settings, and to provide packages of care for those very complex discharges and things. So just the last slide is to let you know what's coming up over the next 12 to 18 months. Obviously, as a team, we do monitor all of those contracts and we monitor their performance. So that's an ongoing sort of piece of administration. The telecare contract will be due for renewal next April. We have the Independent Living Centre, which we support, up for renewal around the same time. Our home from hospital service, again, is due to end, and we need to consider what outcomes that's providing and whether it's the right service being provided. And again, our community equipment, which will be a significant piece of work, that is coming up for renewal in April 2026. And with all of these, it's a good opportunity to think about whether they're delivering what we want them to deliver, whether the outcomes for our residents are those outcomes that meet their needs. So it's quite exciting to be looking at those, and we work very closely, of course, with our ICB colleagues to think about what's needed when we look at those recommissionings. And we have also very recently had some in-house. We will have the urgent care and response at home service as an in-house service as of the 1st of August this year. This was taken in-house by us because Medvivo didn't feel they wanted to continue with their final year of the contract. So there's been a lot of work underway to bring that in-house. And the Home First service will be provided by Wiltshire Council as a single provider service as of April 2025. So that is another sort of very exciting piece of work there for Helen Henderson's team to bring those in-house. And I think this is my last slide. It really is just a snapshot. There's an awful lot that goes on under that 68 million. So I'm very happy to go into more detail on any particular parts that may be of interest to anybody. But that was just a bit of a whistle-stop tour.
Thank you. Thank you, Helen. Does anybody have any questions? David Bowler.
It's just one particular slide on the BCF performance metrics. And perhaps I'm being a bit thick, but it shows there on the admissions to residential care, 7 for 23-24, 735 per 100,000, down in 2022-24 to 442, which seems a significant drop when you consider that we're getting more and more applications for residential care homes to be opened.
So this is a nuance of the national reporting. So last year we were asked to report based on SALT data, which is the ASCOF type related data that we have to provide. And that's what the team's metrics were based on. Now that data included anybody that went into hospital from a care home and then went home to a care home. They were classed as admissions. Now, within the council, in terms of our operational planning and our funding, we're only really interested in those new admissions, those per year. So what we've done is I've based this year's plan on last year's new admissions, It's probably it's a presentational thing really, because we are no longer required to use the ASCOF data because that has now changed. So we're being asked to collect this locally under our own agreed methods now. So this year's challenge is still quite challenging, but it's not as challenging as it looks. So I think last year, I don't know actually, Carl, you can find, what was last year's new admissions? Can we find that? I can find that for you because we can look it up. I think the last year's new admissions might have been something like 470. It's just a bit of a nuance of what data we had to use. So we've stretched ourselves, but not quite as much as it looks.
It probably would have been helpful in a way that if there was a third column that showed you the admissions for last year, new admissions, and then you could have compared like for like, whereas what it appears here that we're not comparing like for like. And I do understand, I think I understand what you were saying, that if there was a resident in a care home then went into hospital and came back into a care home, that could be seen in the year probably 2 admissions, which, I mean, having my background in care, I've been a bit concerned about the policy really of what happened. We had one of our neighbours who went into hospital in Swindon, finished up in Salisbury in a care home, then was admitted to hospital in Bath, was admitted to a care home in Chippenham, and then went back to a care home elsewhere. And I was quite appalled that as a practice for an elderly person who was on the edge of dementia, not demented, but on the edge of it, she was very confused. And I just thought to myself how confusing that was for the elderly person, and as she had no family, it moved away from all contacts. So I am concerned about the practice as well as the numbers. Thank you.
Helen, Alison, beg your pardon.
Thank you. Can I just respond? So our practice within adult social care is that wherever possible, we don't discharge from hospital into a care home facility, because we think it's more important that people are able to go home. I think we need to remember that if you go into hospital and then you are discharged into a care home, you'll never see your house again. You'll never see your animals again. It's a very cruel thing to do to people. So wherever possible, we do not discharge into a care home. And that's the policy of the council, okay? There are occasions where people need some short-term respite, if you like, on discharge, because people are discharged much quicker these days, aren't they? And sometimes we will use what we call a discharge to assess bed that will be for a short time before we can get people home. And so that's what we also do. Where people are moved, as you have described, that is very, very unsatisfactory. And I'm happy to look at that case if you want me to.
Can I just respond, just because you're pointing out, I managed to get your details. Last year, we did admit 503 to those care homes last year. So our stretch target this year of 442 is where we balanced ourselves. But it was 503 last year.
David Vigar.
Yeah, thank you. Sorry, it's a bit of a similar question to one I asked earlier, and probably not an easy question or easy to answer, so I apologise for possibly being a bit confusing. But my understanding of the Better Care Fund is this a fund from government to Wiltshire, is that correct? So we apply for a pot of money that comes from government, and that sits alongside what you might call our core adult social care budget. Is that right? So the core adult social care budget, I think, is about 180 million. And this is 68, so they're set, that's 180 plus 68, or is the 68 part of the 180?
Alison.
Yeah, so it's not strictly true to say that it's a fund from government. The original, for those of us who are long enough in the tooth, the original establishment of the Better Care Fund was funds from health and funds from the local authority, no new money. So we put in funds, health and ourselves, to create the Better Care Fund. The purpose of it was to ensure a greater integrated response to health and social care. So it gave us an ability to work together to jointly commission services that would improve integrated working across health and social care. Now, we could probably spend the rest of the day discussing whether that worked or not, but we still have that, that fund. So the Better Care Fund we still have. It's uplifted every year by government, so there is a government uplift. So, and we jointly decide how we spend that money. We spend a large proportion of it on adult social care services. We spend a large proportion of it on health services, and then we have other services that we commission jointly. But it's in addition to the adult social care budget and in addition to the health budget.
Okay, so it's in addition to the 180 million that we have for adult social care, and it's provided by the local, by us, Wiltshire, by the care providers and by the NHS together. Is that essentially?
Yeah, it's together, and all decisions about spend have to be made
so
together.
if it's separate to the 180, then, I mean, correct me if I'm wrong, but when I look at things like reablement, do not we have a reablement service within the core budget as well? And that's one question, and how do they fit together? And the second, I think you mentioned that about a proportion, it's, 40%, 28 million of the 68 is used for system-wide support. Is that, and I'm not saying this is a bad thing, but is that basically just subsidising the core services and supporting them, or is it doing something different? So then when I look at the metrics that say BCF on top of them, performance metrics, ones we've just been talking about, for example, admissions to residential care homes, are they the same metrics that you would see if this was a report from the core adult social care team in Wiltshire, or is it some sort of slice of it that just relates to the BCF?
So it just...
You understand my confusion by the questions I'm asking?
Yeah, so it just relates to the BCF. So these are the metrics that national team, that Helen has to work with, that the national team set for the BCF. So they're just the metrics for that. So health will have different metrics for the rest of its services. Adult social care will have different metrics for the rest of its services, okay? So reablement is funded from the BCF. It's a council service, but it's funded by the BCF. Yeah. It's all of it, isn't it, Helen?
That one, I'm just doing a piece of work to look at how much of each service is actually funded by BCF, but it's certainly a significant
large
proportion.
proportion,
Yeah, and a lot of them are. A lot of them are 100% funded by BCF.
So the final bit was system-wide support. Just explain how that, what that kind of means. I can understand contracts, but the system-wide support, if you could just unpack that a little bit.
This was a bit of a very quick sort of bit of analysis we did last year when we had the national team visiting around how we just categorise some of the schemes. Now there's a list of about 60 to 70 lines with the schemes, and so I sort of went through there, and I think the wider support was around those elements where we are supporting capacity within those adult social care teams, and it could be across a whole range of things. We might provide funding for roles, but it was about that support capacity. And this year I might change the titles, I don't know, to make them a little bit more useful if I do that analysis again. So
I appreciate it's complex. Thank you very much.
Yeah, I'm getting a bit confused. Who actually holds the Better Care Fund? My understanding was that it was held by health, paid to health, and that we claim from it. Is that not the case anymore?
No, so it's held by us. So we manage the Better Care Fund.
The whole of
the whole of it on behalf of ourselves and health.
Oh, yes, separate to our budget then.
Separate to our budget,
that's
okay?
the point I'm getting at.
Yeah.
Yes, that's what I understood.
Yeah.
It's held, but it's not, in theory, money paid to Wiltshire Council. It's held by us, and then we distribute it and claim part of it for ourselves, obviously.
So part of it funds adult social care, absolutely. Part of it funds health services, and we have to make decisions about how we spend it with our colleagues in health. Joint decisions, okay?
That's what I did understand. I was just making absolutely clear. I had got it in my head that it wasn't part of Wiltshire Council's budget. It's a fund that is held by us to distribute some of it back to us, obviously. But that's what I understood. Thank you very much for clarity. And one other question I did have, which sometimes we're critical of the jargon. Sometimes we ask for it to be simple, but I've got a simple one now that actually you refer to bedded settings. What do you?
So apologies for our jargon. So what we meant by that was care home facilities.
That's what I put down. Do you mean care homes? Oh, that's all right. I just wondered whether, having asked for simplicity,
We made it more complicated, yes.
too simple for my brain.
We do that very well, so apologies.
No,
yeah.
thank you very much indeed.
Well, I had to Google Ascoff. Is there any other, Michael?
Oh, sorry.
Any other questions? No. Then can we think about recommendations? Then can we move to receive an update in 12 months or sooner if issues are raised by Health and Wellbeing Board with focus on the community equipment and any adjustments to the budget to meet demand? Okay, is that all right with you? Thank you. All those in favour, please show. Thank you very much. Item 10 is urgent items. I beg your pardon, the forward work plan, item 9. Now then, Marie, we'll apply to the next meeting.
No, it's quite busy, I think.
Right.
This one. These haven't got dates yet. We've got quite a lot of September.
Yeah. So we have our next meeting on the 10th of September, which we plan to looking at user involvement, dementia care, primary community care delivery plans, technology-enabled care, and urgent care at home, which sounds quite a lot, actually. And ongoing updates relating to the CQC inspection of adult social care and integrated care implementation plans. I think that we need to pare that down, really. Which 3 items do people consider? David.
Sorry, confused again. On page 55, I see it says rapid scrutiny of integrated care strategy implementation plan, June 24. Did we do that?
That's a joint venture with the Children's Select Committee, which Julie Bilby is managing.
Been done.
No, it's still ongoing.
Yeah, it's ongoing.
Oh, I see. Okay.
It's working, in other words.
No, I was going to just, while I've got the mic on, I was going to say what I would quite like to see is a very short report, before we end this cycle of the council, on implementation of the Integrated Care Board, Integrated Care Strategy, Integrated Care Partnership, that whole thing. Just a very short report on what were the aims and what has been achieved, so we can see it very clearly, because we look at a lot of detailed parts of the machine, but just an overview would be really helpful, I think.
Well, we asked for that earlier. Yeah.
Total overview of the ICB, not just parts of it, not neighbourhood collaboratives or something, but the total ICB, top down, what were the objectives and how have we done? Maybe towards the back end of this year, beginning of next, I thought would be a useful thing for us to see.
We'll add that to it. Probably in November or early in the...
Ideally with the chair and chief exec of the ICB.
Yeah. So, do you want to leave it to Johnny and I to pick out the 3 for the meeting on the September, or does anybody have something they really want to see on there? Okay, Johnny and I will make the selections then. Next is urgent items. I have none. The date of the next meeting is the 10th of September 2024 at 10:30, which should be back in the Kennet room, I hope. I really apologise for it being in this room today and the quality of the sound recordings. Can I just remind everybody that there are interviews taking place on this floor today, which is the reason why we are in this room. So as we leave, can we make sure that we are extra specially quiet? Yeah, thank you. Thank you all very much for your attendance and your contributions.